Hi, I'm Mark Olives, and today I'd like to talk to you about MRIs. So every day I get patients, they come in with their MRI findings, or they suggest to me that they'd like to get an MRI regarding their condition. And I always caution them and I say, well, be very careful with what you find or what you see with an MRI finding. The reason for that is several reasons. Number one, anecdotally, if you ask an orthopedic surgeon how accurate do you think the findings are from an MRI, frequently they'll tell you only about 50%. So half the time, if an MRI shows a tear in, say, a rotator cuff or a tear in a meniscus in the knee, the surgeon will go in there and find out there's no tear there at all. Or the situation can be reversed, that oftentimes the MRI will not show that there's anything there. The surgeon will go in and find out there's a huge mess in there. So I always tell patients you have to take the MRI with a grain of salt. The MRI can be a very good tool, but by itself, not necessarily the most accurate. You have to utilize other judgment, you have to utilize other findings with someone, and you cannot just say, the MRI is the gospel, that's the end of the story. So when people bring me their MRIs and they tell me I've definitely got this problem, I say, well, the MRI shows that, but that is not necessarily the case. So never rely on the MRI to make a 100% accurate diagnosis. Another condition, the spine. I frequently have people get MRIs with that. I tell them all the time, the American Academy of Spine Surgeons did a study and found out that MRIs and X-ray combined are 90% wrong. 90% wrong. I could throw darts at a dartboard and be more accurate than that. That is a terrible statistic. The reason is very simple to explain as to why this is true, and it's because if I take 10 people, only one person has a problem, I put them in an MRI machine, and then I put the findings up in front of a doctor to read them and try and ascertain who's got the problem. The fact is, everyone's got problems. Once you're beyond the age of 30, you've got degenerative disc disease, you've got degenerative joint disease, you've got spinal stenosis, you've got a lot of different things that are going on, and so for a doctor to try and decide, well, which person's the one with pain, it's almost impossible. So again, if you have a back problem and you go to a surgeon and they do an MRI and it shows you've got a certain condition, does that mean for sure that's a problem? Not necessarily. That might be an old problem. You might have been living with that for years. Or there might be multiple problems. How do you know which one is currently causing the problem? Frequently you do not. So always take the MRI as a tool that's just one piece of the puzzle to help you to diagnose a problem. It is not the be-all, end-all. It is not the most accurate tool in the world. So I hope this helps to clear up some confusion or helps give you more clarity regarding your MRI findings, and hopefully this will help you to make better decisions regarding your health. Thanks.